again, please.
So like, I know with the COVID, there's not much happening. It's before COVID. Are there any like screening programs going on, or like like free for people to just go for screening, or they have to pay for their own?
Yes, so we do have certain organizations that were offering free screening or subsidized screening. So parastatals and NGOs, places like Zimbabwe Family Planning Council, the one located, I think, close to Harare Hospital. Yeah, women could go there and, you know, get their screening and family planning services there. Cancer Association, I think they just charge a token fee, but for patients that are struggling, they do it for free. Parry and Harare Hospital, not so much. I know Parry, they tried at some point, but yeah, it doesn't actually, you know, they don't do for everybody. You can't just walk in there. They've got limited number of patients that they take. So I think the issue is for a screening program to work for a particular population, it has to, you know, reach at least 75 to 90% of women, you know, that are at the at-risk population. So if we're only reaching maybe certain women in towns or select women in the rural areas because a particular NGO is doing a study in a particular district or province, it's not countrywide. So we do not get to see results when you're not, you know, accessing everybody that needs to be accessed. Yeah, and you'd find there's a lot of stigma around cervical cancer. It's very unfortunate. A lot of women would prefer to be diagnosed with breast cancer because, you know, it's a disease of the elite. But cervical cancer, you know, the experience that I've had treating patients with cervical cancer, you'd find that they do suffer from the stigma that they get from you know, just the general public. Even if they're on cancer support groups, you know, the support that breast cancer gets is so different from the support that cervical cancer gets. I remember the one patient, you know, complaining, she was part of a group, a support group where they had, yeah, different cancers. And, you know, they started arguing amongst themselves. So the one woman says to this lady, she's like, oh, you were unfaithful or you were promiscuous. You've got the promiscuous cancer. So, you know, we have a lot of work to do because once, you know, you label a particular cancer like that, a lot of women are not willing to come out. They're not willing to form cervical cancer support groups when, you know, we have so many breast cancer support groups. But this is really our disease, cervical cancer in Zimbabwe. That's our disease. So there's a lot of work that needs to be done.
Okay, thank you.
You're welcome.
Would maybe culture contributes to the many cases of cervical cancer as well? Because I know a lot of traditional medicines, you know, especially for things like period pains or, you know, people start using all sorts of stuff. Would that be a contribution to the high cases?
Yeah, so the cultural thing, definitely it does come in. And so people inserting herbs and stuff into their vagina, you know, mostly that practice is not well versed with it, but, you know, some women talk about vaginal tightening, you know, using these herbs. And unfortunately, what happens with those, once you introduce herbs and things into the vagina, it makes the cervix more vulnerable to getting that HPV virus. And once that happens, if one has, you know, a cervix that is more vulnerable, then the chances of clearing the HPV virus is much less, and because of that damaged cervix from the herbs, and then their risk of developing cervical cancer is a lot more. So yeah, it is something that, you know, we also need to push towards, that women need to stop inserting things into their vagina. Yeah. Yeah. And then another thing is also just having multiparity, having lots of children. That also has been found to be a risk factor. So we're usually looking at children over 5 children or more as a risk factor. So you'd find we do get situations where you have a woman who's had 8 children, 10 children. Yeah, that definitely increases the risk. Yeah, so that can also be a factor for developing nations where families tend to be quite large.
I read somewhere about home screening tests. Do you know anything about that? Are they available at all? Well, I haven't looked into them here, but I heard that they are quite available around here. Would that help?
Yes. Yeah, that's actually quite exciting because, I'm sure we've all had pap smears done and they can be uncomfortable. And it doesn't really matter who's doing it, who's performing it, a male doctor, a female doctor, it is quite invasive. So the home tests do come in handy because, one has this testing kit that you do in the comfort of your home and then ship it to the lab. And, you have your doctor give you the results. So it's, a lot of women actually refuse to have a pap smear because of that discomfort. Yeah, so those home tests, I honestly wish and hope that we can have them also here in Zimbabwe, because I think we'll actually see a lot more women actually agreeing to get tested. Yeah, they're good.
Are there any more questions?
What's the situation like in the UK with cervical cancer?
We get invited, is it every 3 years? I can't remember how often, but we get invited to go, and you can also just go on your own as well. So I always wait for an invite. I don't volunteer.
Is it free?
It's free. It's free.
Okay. So you guys are having the pap test and VIAC?
No, just the pap test.
All right.
Anyone else had the VIAC? Has anyone had the VIAC? No. Yeah, just the pap test. But there are so many, it's very often that you get called back because of it's inconclusive, or is that a problem at all? Is it just because of the lab? What do you think is the problem? I've been
you mean the pap test being?
Yes.
The pap test or the VIAC?
The pap test.
The pap test.
Yeah.
Oh yes. Yeah, that can happen, especially the early precancerous changes. Yeah, because we've got a spectrum. We call it intraepithelial neoplasia. So this is those changes that we want to pick up before there's invasion of the stroma, before there's actual deeper invasion. So we call that precancer. So that's a spectrum of changes. Hey, we used to call it CIN 1, 2, 3 before, but now we've just got 2 stages. We call it squamous intraepithelial lesion. So that you've got the mild changes, intermediate changes, and more aggressive changes. And so it does cause, a bit of confusion for the lab that's seeing that. They don't want to miss cancer, but at the same time, they see those changes. So it's important when they see them to call a woman back to have the tests repeated earlier rather than later. So the 3 early ones, you want to do that for a woman who's had, usually we talk about 3 consecutive annual negative tests. And then she can be, she can have it less frequent, the 3 early ones. But when one is having the 3 early ones and you do see those abnormal changes, you want to repeat it in 6 months, you want to repeat it earlier. So it's that issue that we get a whole spectrum of precancerous changes, that results in that, calling the patient back for another earlier test,
Okay.
Mm-hmm.
Wow, very interesting. Thank you very much. Any more questions?
Yes.
Welcome, Blessing Muriro. He's just waving. Okay.
I've got a question.
Yeah.
Yeah, I just wanted to ask, like here in the UK, if you're a woman above the age of 45 and you develop problems like with your ovaries or your uterus, or maybe serious problems with your cervix, the MDM decision is they do a total removal of the organs. Is it the same in Zimbabwe?
Yeah. In Zimbabwe, it's tricky. Those MDM meetings, multidisciplinary meetings, yeah, we do not, we do have them, but yeah, we do them sparingly. So it does help, when you have the multidisciplinary meetings, that you've got different disciplines that are meeting and discussing. And, you might have also your family practitioner who knows your history. You've got the gynecologist. So one makes a decision based on that. You have, knowing one's family history. If one has a strong family history of cancers and things like that, then okay, one has a higher risk of getting ovarian cancer, uterine cancer, cervical cancer. So without that, it's just difficult to recommend, one having a hysterectomy. But we see a lot of women who are postmenopausal getting hysterectomies. The thinking is, I don't need this uterus anymore, so I'm not going to have more children. So we do see a lot of women when they start having, from fibroids, menorrhagia, this heavy menses, like you're saying, maybe chronic pelvic pain.
Today, I spoke to me today, and I asked for on phone. I said I'd get to call you back.
Now,
okay, already. I'll call them back.
I told them.
sorry, now, can you put your thing on mute? Mine now.
I think it's on mute. Sorry.
No,
Hold on, sorry.
Okay,
Sorry.
thank you. Sorry, Dr. Tsikai.
Yeah, so yeah, we are actually seeing, but it's more, what can I say, patient preference, not necessarily driven by, by the doctors. Yeah. The younger women, it is difficult. Oh, we struggle with the younger women, even with frank cancer, stage 1 cancer, and we recommend removal of the uterus. Yeah, we can struggle with some women. Some will tell you, I've only got 1 child or 2 children, I need more. And you're trying to tell her, but no, you've got this cervical cancer, and it's a choice between you having more children or losing your life. And yeah, we've lost quite a number of younger women who refuse to have their uterus removed because they're afraid that their husband will leave them. If they can't give them more children, or, if they don't have a uterus, they think the husband will think they're half woman. So yeah, we've lost quite a number of young women. Yeah.
Do you have any idea of the prices if you want to have the screening done privately? How much is charged?
Yeah, so it depends. So looking at just the pap smear, it ranges. Some lab tests will charge between $20 and $100. And then if you're having the HPV virus testing as well, the liquid cytology as well, that's a little bit more expensive. But yeah, I find for the patients that can afford the HPV test, it helps, because then one can confidently have the pap test less frequently, because if you're not infected with HPV virus, then you know that your risk within a year or 2 of developing cervical cancer is much less. So we're comfortable to do 3 yearly. But if one is positive for HPV, then we recommend annual tests because the risk is higher. For HIV positive women, we recommend more frequently. So definitely annually for HIV positive women, because the risk of faster progression to cervical cancer from your precancerous changes is it is much faster. Yeah.
Would they need to pay as well, the HIV women, or is it?
If they're getting their medication from the government centers, no, they do get those checks for free. Although still it is quite erratic, because when I was still working at Parry, would see a lot of women that would have been getting their antiretroviral drugs for 10 years plus, and then coming with stage 3 cervical cancer. And, we always used to have issues with the opportunistic infections clinic to say, but, you've been seeing this woman coming regularly for a medication every 3 months, every 6 months, but, you never bothered, checking for cervical cancer, which, we know it can be HIV related. So, but I think there has been a movement. You'd find we've got an HIV clinic in Newland. They do pap smears annually for their women. Yeah.
Any more questions?
I've just discovered that, like, here in UK, fibroids are very common among blacks, and I don't know whether it's a thing. I know they're common because I had my fibroids when I was in Zimbabwe, and I know a few Zimbabweans here as well who've got like fibroid uterus. Is it something that would have caused it, or like because of background or anything?
Fibroids. Now, fibroids generally occur to most women have fibroids. It's just different for different women how severe the problem gets. And it also depends on where the fibroid is growing. So you can actually have small fibroids that are growing just under the uterine lining that can cause heavy bleeding. And compare that to a woman who has fibroids growing, on the outside part of the uterus, and they'll never know that they had fibroids. So the location is very important. For some women, it can block their cervical canal. They can block their chances of having children. So then, that fibroid becomes a problem. So it really depends on the particular woman, how the fibroid is affecting her. But a lot of women have them, and they don't even know that they have them. Yeah, they're asymptomatic. So they are quite common. In terms of the causes, the causes of fibroids are generally not known really. And most of them, they're benign. They're not cancerous. Yeah.
Somebody asked in the chat, she says, is it easy for someone to ask to have the uterus removed without having any cancerous symptoms? Suppose if you just want it removed to reduce chances of cervical cancer.
Yeah, that one is tricky, unless if one has, a particular reason. So if one is positive for HPV virus, and we know that, because you have the HPV virus that's infected your cervix, your risk of developing cervical cancer is much higher, then we can consider that. But, or if one has a family history of, cervical cancer. But without that, it's very difficult to recommend removal of the uterus without, strong family risk or strong personal risk for developing the cancer. Why? Because, that operation also comes with its own risks. So it's something that we don't routinely do, I know when people talk about breast cancer, one can have their breast removed and reconstruction. But also for that, we have to have a strong reason. It's either one has a genetic risk, BRCA mutation that increases the risk of one developing breast cancer, and we recommend removal. But not just anybody saying, oh, I don't want to have breast cancer, because it's the most common cancer, breast cancer worldwide. I don't want to remove both my breasts. It's difficult to recommend something like that, unfortunately.
Wow, thank you very much. It's very informative talk. We've learned a lot, haven't we, people?
Thank you
We
very
have learned a lot, yes. So thank you very much for giving us your time, Dr. Tsikai. And from Kubatana, we thank you everyone for coming and being with us. As you know, we will repeat, we will not get tired because this is our mandate. We are here to help the poor in society, those who are underprivileged to access healthcare. And part of our mission is also for information. And as you heard from the talk, Dr. Tsikai also stressed that it's important to catch these diseases before they progress. Gives a good outcome, patient outcome. And we really want us to all be educated, spread the education, because it's not just for us. We are not going to continue living just for ourselves. We're going to help those around us and those who do not know, those round the corner, who live round the corner, who know nobody. We want to help those as well. So thank you very much, and continue contributing, donating. We ask for just £5 a month. If you can afford to give us more, we'll be really grateful. Your money, the money goes to a lot of good use. Follow us on Facebook. You'll see some of the project we've been involved in, and we also have a YouTube channel and Instagram. So from Kubatana, until next time, we'll see.